All right, we're gonna be working today on part two of the chip and the goat. So we're gonna start today with enceotic posthitis and balanoposthitis. Basically, the common name for this condition is called pistol root, and basically, this condition is a genital urinary condition where we can have scabs, we can have ulcers, all those around the prepuce on the male goat. So pretty common condition going on in the male goat, mostly on castrated males, no problem. This usually happens to them. On the females, it can happen with a presentation of vulvar swallowing, scabs, and ulcers as well. So mostly a genitally urinary condition. This condition, the enceotic posthitis or balanoposthitis, in the male will be balanoposthitis, in the female posthitis. It is basically diagnosed with culture sensitivity, pretty much for diagnosis. And what we're going to be finding here is going to be the Corynebacterium renale. Pretty bad bacteria causing all this irritation, all these scabs and ulcers, affecting all the genital urinary area. Diagnostics for this one, differential diagnostics, we can think anything like urolithiasis, granular posthitis, herpes, viral balanoposthitis, or ORF. Pretty similar, right? Herpes, granular posthitis, urolithiasis. So treatment, basically isolation, low protein diet, clip and clean the area. Some people, they might even use iodine to clean the area. That will help pretty good. You can use those scrubs that they have available, iodine scrubs to clean all the genitalia area and rinse it out pretty well. Wearing gloves, of course. And then to avoid antibiotics, we can give in a little bit of penicillin or cephalosporin. So everything depends on the goat. If they let you clean it and everything, it'll be easier. If not, we just got to go with antibiotics straight out. So they said there's a possibility that high protein diets could be a factor on this. So many researchers, they're considering that as a possible, but it's a factor. So to consider on the herd, probably because of the acidity. Not really sure, but that's what is on the literature. All right. Well, that's pretty much all for pistol root or balanoposthitis. All right. Our next topic today is going to be hypomagnesemia tetany, and basically on chips. We're going to be also calling this grass tetany or lactating ewe. That's another term. Presenting pretty much with convulsions, a little bit of paddling. It can be strong at the point that they can die. So be aware of that. Polyuria is a possibility. Stiff gait, it's a possibility. It is magnesium. It's needed for the heart. So you know that. Maybe check your heart to be sure there's no any dearrangements. Some patients, they might show a little bit of convulsions, distress. So it is presentation of pretty rough sometimes, mostly like neuromuscular presentation because of the importance of magnesium. So differential diagnostics, we can have lead poisoning, for example, hypocalcemia, rabies, hypomagnesemia. Of course, it's going to be pretty low. We're going to be like on the minus 0.5 milligrams, so in blood. So it's going to be pretty low. So be aware of that. The hypocalcemia on total calcium, we're going to be below 8, so, which is a pretty low number. Remember, usually we do ionize, should to be half of that, but we're going to be less than that probably. So there's also a good relation between calcium and magnesium. And of course, if we have low calcium, we're going to have calcium and magnesium being low together. So basically, the treatment usually comes together. Same thing, magnesium and calcium together. We're going to be giving this IV slow, and then we're going to be continuing with magnesium oxide by mouth. So yeah, let's keep an eye on these things. Basically, if you see any kind of like weird convulsion, grass tetany, lactating ewe, kind of related to this, there's a possibility that it's happening, and Sometimes, it could be diagnosed like a rabies or another neuro disease. But if we check those levels and they're low, calcium low, magnesium low, it is a big thing to consider. Next topic is going to be about intestinal worms. Basically, we're seeing few different ones. They're like the most common ones, and in this case, we're talking about nematodes. And the main one, it is Emonchus contortus. That's a big one going on here. So with this type of worms, usually we start seeing a lot of weakness and a lot of weight loss, and we can have bottle jaw, and that's basically because of the hypoproteinemia, because we start losing protein and we start creating edema. That's what's going on. It's nothing to do with, for example, the other case that we're talking about cows yesterday, actinobacillosis and actinomycosis. Usually when they have actinomycosis, what they start like creating the bottle jaw, but it's a different thing. This is it is basically invasion of the harder tissue getting softer. But the reason, because we have bottle jaw here, is just hypoproteinemia, so it's something different than that. And of course, one of the main things, it will be anemia. This type of bugs, they always tend to have this patient with low blood on the periphery, because they're like parasiting. So the thing with this type of bug is like it has high fecundity, so it can fecundate like millions. One worm can put like 5,000 eggs, so it's crazy. And this is every 24 hours, only one worm. So there's a lot of progeny on this one, so I have to be pretty careful with this. So we start seeing a little bit of hyperproteinemia with the bottle jaw, anemia, and we are like pretty much still in this. So one of the main things that has been going on lately in veterinary medicine is try to avoid the use of intestinal dewormers too often, because we've been creating so much resistance to these bugs, to the type of medications that we have in the market. So for goats lately, and consider mostly for Emonchus contortus, we've been working on a score that is called FAMACA. So FAMACA score, or FAMACA score, is helping us to determine, based on the color of the conjunctiva, how parasite is this patient, and kind of determining the need if we're really facing time of the year where we need to start deworming these patients. So let's look on the FAMACA score. There's a chart that has 5 different type of colors of conjunctiva, and what you should be doing is pretty much taking a look at your goat, place your hand under the chin, hold the head, put it against the wall, and try to look try to get used to them and look at the conjunctiva, and based on that conjunctiva color, we're going to start determining if the grade of parasitism is a high grade, or is a low grade, is a middle grade. Usually the score goes 1 to 5, and consider mostly the time, of course, the worst ones to be the numbers 5s. Anywhere between 1, 2, and 3 could be acceptable. But if you're going on the 4 or 5, certainly you're going to be pretty pale, and that's when you start considering one of those things can start like affecting too much the goat, and that's a time for start deworming. And if we have a good color, they might have some parasitism right there in the middle, but as part of the cycle, we cannot make it sterile forever. I'm also considering the outside, and depending on the time of the year. So other differential diagnostic with this type of nematodes, it will be Trichostrongylus, Telosarcia, Coprira, Ossofagostomum, Nematodoris, and Trichuris bulpi. You remember that one, Trichuris bulpi. So as we said before, this thing called the barber pole or Emonchus contortus, medical treated just when it's needed. Another thing that we've been also looking in, it's the refugia. I don't know if you heard about refugia plan, but that's basically try to make the worm more sensitive to the type of breed of animal that you are working with. And the only way to do this is basically trying to get rid of those worms and dilute this with different type of genes on a new breeds where some animals are more resistant than other ones. But for doing that one, you have to do a lot of surveillance. You have to survey in order to find out which animals are more resistant, start creating new lineage of animals that are more resistant to the worm. Avoid any frequent treatment with anthelmintics, as we said before, because of the resistance of the parasites. Avoid any underdosing, because you're just giving a micro doses and those parasites are just eating it up and getting stronger and stronger anytime that you do that, because it's not toxic for them anymore. It's like an alcoholic, you know. It drinks a little bit of alcohol, a little bit of time, every day is more resistance to it. Treating and moving to the clean pasture is another thing that you can start doing, just kind of rotating. And so we're trying to find out if there's a minimum larva on those new pastures. But yes, basically new breeds, make it more sensitive to the worm. There's a refugia plan. And in other words, just check for the FAMACHA score and also, you know, your physical exam as usual, and determining something else on the physical can give you a clue. Then if you want to do your fecal, you're welcome to do it. But most of the time, you know, these guys is kind of like mostly physical exams, and FAMACHA is kind of like taking over the expenses of the fecal exams too. All right, we're here with intersex syndrome. All right, something that commonly you can see on goats is intersex syndrome. Basically, females with testes, so it's a lot of testosterone going over there. Female with testes, and but they're not true hermaphrodites, but they still have testes and ovotest. So one of the ones that is more implicated is a Western Euro breed, which is called a bull goat. It looks like this type of breed that is coming from Europe. It has the type of genetics where they're showing the intersex syndrome, this aberrant syndrome that is coming from there. Differential diagnosis for this one, it'll be free Martinism, which is another condition that we talked previously. Usually when we have, you know, a chipped twin, in 20% of the cases, one of the females ending getting like a characteristic of the male. In goats, usually you don't see that often. Usually it's kind of like 1% or less than 1%. But sheep, it has a pretty high number of free Martinism, so be aware of that. It's also coming from Europe as well. So basically, if we have a male that is intersex, it's going to have the male phenotype, and then at the same time, it's going to have the female phenotype. So basically, it has both of the reproductive systems, which they're not really working, but they're still sitting right there. Treatment, basically, it is too cool. We don't want it to be like continue with this type of aberrant breeds, because they're not really good for the herd. They're not good for reproduction, and they just come in more issues. So on the male pool of mossy goat is more going to fertilizing, because it's still like a segment epididymal, so they can still having some fertilization, but you don't want to breed this type of thing. So usually these aberrant conditions on these goats, we just control and cooling and pretty much. But yeah, remember, it's not a true hermaphrodite, but yes, it happens. It happens a lot in this type of goats. All right, we'll talk about a little bit of mastitis and neonatal diarrhea in goats. Basically, mastitis, we can have that one, same thing than the cow, just some production goats. Um, Remember, the goats, they have a apocrine um, fashion production of milk, so it's a little different than the cow, right? Its production is different. Usually goats, because of this apocrine condition, they usually have a high somatic account. We're talking about like over 1 million. And remember, in cows, we're seeing like the 200,000s, right? It's almost 5 times more than we're expecting in a cow. Um, so usually this somatic account is so high because we have so much present on neutrophils in the milk. So it can lead to subclinical infection if we have mastitis. Staphylococcus, 71% of the time, is one of the implicators. And then the aureus, we're talking about like 8%, strep about 6%, and corina about 3%. So on this one, we typically test it and then we cool it off. That's what we do with goats. Most of the time, they don't really want to deal with mastitis in goats, but you can still do your intramammary antibiotics and some support as needed. See the patient recover, but if this is a recurring thing, most of the time you're going to be dealing with this. And in goats, you're just trying to clean the lineage, and as long as you clean the lineage, you should be fine. Creating new lineage, more resistance to this type of infections with these bacterial infections. But I think cleaning plays a good role, so keep it in your mind, because you don't have a good hygiene, that's when things start happening. And not talking about the environment, I'm talking about the people who's messing with the goats, techniques, utensils, everything else. Neonatal diarrhea, on the other hand, we have coronavirus and rotavirus, which it could be one of those bugs that could be affecting over here, instigators, bacteria, E. coli, and salmonella. Those are also another ones. So we have a couple rota and corona on the viral side, bacteria. And then protozoa, we have a Cristoporidium. So be sure there's no like a fellow passage transfer, because as we talked before, all the neonatal diarrheas are basically because poor failed passage transfer. The gut is open, and the horse is the same thing, and the cow is the same thing, and the goat, why is it going to be different? You're not like getting good immunoglobulins, then you're going to have these issues. So consider your cholesterol management as anywhere else, just to be sure that there's no like a poor failure of passage transfer, just to be sure that this is not attributed because of that. So poor immune system. In adult goats, it can happen. They can have diarrhea as well, mostly related with jaundice, which is paratuberculosis or Mycobacterium paratuberculosis, avium paratuberculosis, as we talked before. They can have normal feces when they're young, but once again, we have a chronic shedder, right? Like the other ones, they're always shedding chronically, even if you have normal feces. So we have to be pretty vigilant. So yeah, be sure the Corynebacterius is not showing like a pseudo diarrhea or pseudo jaundice, because sometimes Corynea can be confused with jaundice as well, and then we can have a erroneous test. Yeah, but basically, just keep an eye on those diarrheas, because if we have something like jaundice, that's something that we might need to consider to take some action on it. And the other ones pretty much just support treatment as we've been doing it before. If it's bacterial, if it's protozoal, antiprotozoal, and if it's virus, just giving some support and try to prevent it with vaccination and cleaning management. Good cholesterol, that's all that we need. All right, time to talk about ovine scrapie. Usually, a scrapie is a fatal progressive disease. Pretty bad neurologic disease. We know that we've been dealing with this for so many years all over the world. And there's eradication programs in different countries all around the world. And as we know before, it is a spongy form of encephalopathy. So neurologic signs for sure. The worst part on this type of diseases is the incubation period. It can take it like anywhere between 2 to 4 years for incubation period. So that's something like it's awful. It could be high transmission on the fetal fluid. So imagine, like having that fetal fluid and transmitting that one with your farm is like really big concern. But there's a program. There's a program right now for FDA. Basically, what we've been doing on FDA, it is big surveillance. All patients that they're going for slaughter, they're going to be tested for ovine scrapie. As you know, ovine scrapie is pretty public concern, pretty much public transmission. And all this happened just in ovines. And goats is not really like something that we'll see, or at least here in the States. We have not really seen that much. But we still have the almost goat that is resistant, the RR, but we still have some issues with that. But it's mostly seen on ovines. So we can also do a little bit of surveillance in this one, and we can submit the whole head if we are seeing any signs going on these animals. Or we can submit just the lymphoid tissue as well, or the thyroid tissue, something smaller. If you don't want to send the whole thing, just the thyroid tissue or lymphoid tissue. That's where this bug can be hiding. And we have a little bit of outbreaks in 2021. We have in Wisconsin and 2019 in Indiana, and they've been like vigilant since those couple outbreaks. But if we have like a sudden death and we don't know what happened, it just happened like suddenly. I mean, you don't mind sending a sample, you can always send it out just in case. It is free. FDA has this program where you can even get advantage of the shipping, the cost. You don't have to pay for anything. They even send you supplies. And but always you need to check with your state veterinarian. They'll give you more indications about this, or check on the webpage of FDA to submit the whole head. And also, they'll send you your ear tags for free, just to be sure that everything is clean on your herd and there's no other issues. But yes, just kind of like uncommon in goats, pretty common on sheep, and that's something that we are working on it. And we have an eradication program going on as today on FDA. All right, a little bit more about ovine reproduction. So basically, we're seeing the falls. Goats are more like going on the fall for reproduction, while lambs they like it more in the spring. So something kind of like a concept to keep in mind. Always goat in the falls and lambs in the spring. And usually we're seeing an average of 5-month gestation period. And so for breeding, we always wanted to have an optimal body score. That's pretty important. So you're not going to have any troubles while the patient is pregnant and then after delivering. So body score anywhere between 2.5 to 3.5 for breeding is perfect. Not too fat, not too thin, right? You get too fat, we have problems. If you get too thin, you will have problems as well. So kind of like right there in the middle. The breeding cycle typically on the sheep, it goes about 35 days. And usually we have 2 cycles in fall. And if it works well, great. And if it's not, typically they like to cull the animals just because they're animals that they're not going to be able to be breed. And they try to keep the lineage, as we said before, where we can have pretty nice breeding skills in there. So pregnancy toxemia, as we talked before, is something that we've seen before. It can happen before gestation. It usually happens when you have multiple fetus, right? When the goat has many of them, sometimes they can have 2 or 3. And it's usually because the need for energy, during this stage, kind of start affecting the patient, the lamb. So we typically recommend to check for an ultrasound 45 to 60 days post-breeding. to minimize any of the toxemia seen before. So with the ultrasound, we have a better idea if everything went fine. We have first timer usually when they have like 70% of their material weight before breeding, it should be good. So gestation, as we talked before, 145 to 150 days. Remember, chip, it doesn't have any corpus luteum dependent once that it passes 75 days of gestation. So the corpus luteum is not going to be in charge. It's not going to be in charge of the gestation anymore once that it passes 75 days. So even if you want to make to abort the chip and you want to give it lutelize, it's not going to work at all, because the progesterone in the chip is going to come out of the placenta. So that's something important that you have to keep it in mind. So placentation or placenta is going to be in charge of progesterone to maintain the pregnancy. And goats are corpus luteum dependent though, like the other animals, but a chip, once that it passes 75 days, it's not. So keep it in mind in case that you're considering anything like that. So ideally, in a perfect world, we'll be having like about 3 lambs in a 2-year period. That would be the best. So, and that'll help us to do early weaning and breeding out of the season. So we can use our artificial insemination techniques. And of course, we're still recommending doing our vaccines prior to reproduction, like Perfringens C and D, what we talked before, and tetanus, because those are important. So that's pretty much it for reproduction and ovine. So just keep an eye on that and be aware the estrus cycles, 17 days on the chip, 21 days on the goat, to keep in mind those numbers. And another thing that we always recommend is to get rid of the whole coat, shear them before parturition. So that also helps a little bit. All right, another pregnancy toxemia. Just to be sure that there's no changes on late gestation and multipurpose patient. This happened because there's like more like energetic demand. We start seeing clinical signs like bruxism, grinding of the teeth. They can get like blind. They can have ataxia. They can get in coma. They can get hepatic lipidosis. They can die. So it usually happens on a late gestation and multipurpose goat. So be aware of that. We can see ketones raising up, plus minus blood on urine. It's a possibility. And of course, we start checking our beta hydroxybutyrate, because since we have the ketones going up, we want to be sure that beta hydroxybutyrate is confirming what we're seeing. So the differential diagnostics for pregnancy and toxemia, it will be like any kind of enterotoxemia, listeria, rabies, hypocalcemia, hypomagnesemia, because of the related signs. So what we're recommending is basically to assess the body score, as we talked before to breed animals. In some cases, if it's required, we have to even do a C-section in order to save the mother and to save the kid. Some cases, they just die. So treatment, basically, we can give if we're giving stabilization treatment and no surgery is required, propylene glycol by mouth, and also check the calcium and potassium and see what deficit we have. Based on those, we're gonna to adjust it a little bit. If the cases are severe, fetus, try to save it or see if the mom will die. There's a possibility. But if the fetus make it, or the kid make it, in other words, IV fluids, dextrose, and just continue with the mom, all the care. If mom make it, we can continue with the whole treatment for any kind of ketonuria, like we see all ketones bodies, which is basically dextrose, insulin, calcium, potassium is needed. So just keep an eye on those things. But yeah, it's kind of like pregnancy and toxemia. It's too much demand for the body, and that's when we start getting ketones. So be aware of that. All right, time to look for pneumonia in goats. Basically, we can have bacteria, we can have viral, we can have parasites. You can have an acute and chronic progressive presentation, of course, so be aware of that. We can have cough, we can have fever, we can have weight loss. Some cases we can have arthritis and neurological signs. When we have some sort of lentivirus, because there's many causes of pneumonia, as we said before, right? We have bacterial presentation, we have viral presentation, and parasite. So depending what we're seeing is pretty much what kind of signs we're going to be ongoing on. But for example, on a viral, we have, for example, parainfluenza, adenovirus, or syncytial virus. So those are the main ones. We can also consider OPP and CAA. That's a possibility. Bacteria, we have a secondary viral from the viral or septicemia. We can have Pasteurella, anemia, Salmonella, or chronic encerotic. Parasites, we can have Dicotoculus, Prostrongulus. So those are parasites. So pretty much the treatment for viral, as we do in any other pneumonia, is support, antibiotics if needed. We can do our serology just to be sure we're not dealing with OPP or CAE, and try to do this twice yearly, as we see before, just to cool it, because we need a more resistant breed. Bacterial, basically antibiotic support and ventilation. That's pretty much, and parasites, anti-helminthics and vaccinate. So anytime that you have one of those sudden deaths for possible pneumonia, do your necropsy, nasal swab, cultures, fecal. Try to rule out different causes, something that could be affecting your heart, but it is pretty common to see bacterial, viruses, or parasites trying to take over. So these poor animals are always outside and always facing the environment, and parasite, viruses, or bacteria, they like them, so they want to eat them like anywhere else in the world. All right, it's time to talk about parasitism again, and we're gonna be considering a few bugs. For example, Lemuria is something that's pretty common, right? Coccidia, Coccidia the goat, Osteotiaga, Trichostrongylus, Hymancus, which is the barber pool. We talked about this before. Remember, hypoproteinemic patients causing a little bit of the bottle jaw, as we talked before, and we talked about pharmacia. Differential diagnosis, Cooper toxicity or jaundice because of the weight loss and sudden death. Remember that. But yeah, we can have that submandibular edema with Hymancus, the barber pool, right? Barber pool. And always check for anemia, check your pharmaca score, be sure everything's within the normal range and nothing horrible. This parasite can cause a lot of diarrhea, so keep an eye on that one, because coccidias are the ones that are like more known for knowing that causing a lot of diarrhea. So diagnosis, we're going to be doing our fecal count. We're going to do McMaster or necropsy. On Osteotiaga, we can even do plasma plasminogen. There's a plasma plasminogen test for Osteotiaga, so keep it in mind. And PCB for Famaca, not really necessary, but mostly just kind of a comparison with the score that we're seeing on our chart. Check for anemia, hold the head pretty good, look at your chart, and then based on that, we'll see where we at. Treatment, target, and if we feel like we really need it, we can use our ivermectin, bemidazoles, or imebutadiazoles. There's a possibility, any of those, so keep an eye on those. For Emeria, which is a coccidia, we can do Trazuril and then rotate that pasture too. Another thing that is pretty good for that one is Ponazuril too. All those expensive, but it works pretty well as well. Rotational grazing, of course, just to keep away from the host. Don't overgaze, and less stress for coccylia. So be aware of that. Don't overdose the patients. Don't underdose the patient. And yeah, and that's kind of like keep an eye on these parasites because, as I said before, it could be coccidia, or it could be like a strongylitis or barber pool nematodes. Those are the ones that are the most common ones. All right, polyencephalomalacia, as we've seen before in cows, blindness, seizure, and coma. You remember we talked about this before. In some cases, we can have cerebral edema, and we can have hypernatremia, and also little bit of edema in the brain. So keep an eye on this. Head pressing, hypermetric, any type of sulfur diet with raw hash with sulfur diet, that can be affecting this situation. So keep an eye on that. So as we talked before, we had to do our differential diagnostics and a neurological disease, listeria, rabies, tetanus, CD. So if you see any animal, cow, goat, or sheep that is head pressing, acting weird, give him thiamine. I mean, as I said before, it's not expensive. If something happens, it's not gonna have any side effects. Just give him thiamine. Always IM. Remember, don't give him anything IV. Okay. So remember also, Bracken Firm, it has thiaminase in there. So check on your area and be sure you're not dealing with this type of plant. Could be altering the rumen. So Bracken Firm, remember Bracken Firm. Pretty important because the rumen could be altered and then we can have the secondary thing because of the diet. Alright, so if you've seen it acting weird, be sure it's not rabies, and if it's no signs of rabies, then you can go ahead and give it thiamine. Nothing is going to happen besides getting better, if it is the case. Alright, time to talk about scrapie again. Weight loss with appetite. We have a lot of scratching all over, a lot of pruritus all over. Always fatal because amyloids on the brain, spongiform form, TSC. So we are diagnosing with a rectal mucosa biopsy or necropsy of the brain. There's no treatment for scrapie, as we talked before, and our differentials basically for scrapie is going to be jaundice, meningitis, rabies, casual lymphadenitis, upper muscle. So be aware of that. UFDA, if we have a program, as we said before, we need to cool them out. And just be aware we don't have any of those weird signs like a scratching all over, lesions because of scratching, kind of like a weird bunny hopping, hypermetric steps when they're walking. Incubation in utero, as we said before, it can take a lifelong for incubation, really, 2 to 5 years for incubation, so that's crazy. So be aware of that. But unfortunately, something that is right there in the market is something that we want to get rid of. So hopefully we can have this program eradicate